Great to meet everyone. We've got a few folks from Formstack on who I'll introduce shortly. Looking forward to the session and seeing lots of familiar names, lots of new names. Looking forward to the discussion today. The topic today is Formstack plus Health Cloud. Bit of a tagline, achieve your Health Cloud vision. What do we mean by that? Well, Formstack is here to help, SIs and customers really reach the full potential, what's possible with Health Cloud. When you've signed up for Health Cloud or Salesforce for that matter, you probably at one point use the term, we want this to be our single source of truth for our, fill in the blank, patient data or whatever kind of that central data source is for you. And, a lot of what we're going to show today is how you can build around Health Cloud for data collection use cases, document automation, digital signature, and more to really achieve that vision for Health Cloud as your single source of truth managing the patient journey. Josh Needler, our phenomenal partner, solution engineer, will be sharing some demos shortly. Shaquille was not able to make it. He's actually on a flight coming back from a Salesforce event, but lots of other great representation from Formstack. On here, I'm seeing Justin Jackson, who's our product manager for Forms for Salesforce, great person to know, always soliciting feedback from the community, feeding into our roadmap. Other team members, I'm seeing Jimmy, Dylan, Adam, and maybe missing some others, but that was just who I saw on earlier. We invited our partners to participate today. The great team from Penrod will be demoing, so you can see what Penrod is doing with Formstack and Health Cloud and answer any questions. Matt and Kevin, we'll have Matt be demoing shortly. Matt DeLello, phenomenal Formstack power user. He was not able to make it as well because of travel conflict, but he did share some input, some insight that I'm going to be sharing shortly as well. The Formstack marketing team did a recent survey. 85% of businesses still using paper. We're here to solve that. We call that Stop Big Paper. We don't want paper to get in the way of healthcare organizations, kind of reaching that full potential of what's possible with Salesforce. So we're on a mission to end paper forms, but also another mission we're on is blank forms. That's a big signal that Formstack can help if you're having patients or anyone for that matter, in your ecosystem filling out blank forms. Data pre-fill, big concept we're going to be talking about and showing today. Ensuring that at the right touch points in your patient journey or other concepts. But the point is, if there's a blank form out there, if you're a healthcare organization, if you're consulting from for a healthcare organization, big signal that there's an opportunity to help. What is Formstack for Salesforce? It's a modular solution that includes both native and off-platform form building, document automation, and digital signature. We'll go through that all today. We'll answer any questions the team has on any of the capabilities. Native to Salesforce is really the centerpiece, what we call the Forms for Salesforce product, building forms directly off of your data model. Works with Health Cloud, works with any vertical cloud, as well as the standard CRM. Both Matt and Josh will be demoing that to you here shortly. Again, data prefill, dynamic prefill, whether that's prefilling a form that's being emailed out to an unauthenticated user, which is a great use case for us. Maybe there's a patient onboarding experience that involves email. You can even email Formstack for Salesforce Forms to an unauthenticated user, perhaps a patient who's receiving that, or a prospective patient who's receiving that and clicking on a secure link. Or big use case for us is deploying forms through the digital experience cloud, pre-filling data off of logged in user and related objects. Use cases, there really are so many, and it can cover from providers to payers to medical devices and pharma. I know Matt DeLello, he loves Formstack for the marketing use cases, consistent lead capture, marketing attribution, campaign analytics, whole area there. And in fact, I think, Kyle, I see on with us here, I know that's a big focus for him and his team. But then it gets deeper into patient onboarding, patient care, utilization management, a whole stream of use cases around medical devices, all of what customers and partners are using Formstack for with Salesforce and Health Cloud. Cortica, really fun one. Arun had a patient experience. We see a lot around patient experience, consistency across the patient journey, really realizing that vision of Health Cloud as the single source of patient data. And then Matt, for those of you that know Matt or don't know Matt, solution architect at Coastal Cloud, again, where Matt really dug in is the marketing use cases tied to increased patient volume, and also kind of the process sees around kind of consistent form-based data capture and how that feeds in to Health Cloud or other data sources for that matter. That was a bit of an intro. Please keep the questions coming, and gonna hand it off to Matt from Penrod first, and then we'll have Josh coming up next.
All right, thanks, Zach. I will go ahead and share my screen here. Let me know if for some reason you do not see it, but you should be seeing it pop up just a second.
And Matt, why don't I let you, again, Penrod is a Salesforce partner, a Formstack partner, specialized in HLS. Matt, do you want to do like a 30-second intro about Penrod before you get into the Formstack piece?
Yeah, happy to. I mean, as you know, Penrod is a consulting company, works in HLS. We work with Salesforce to provide solutions to our clients' needs. Project-based work for the most part, but we have managed service as well. We really want to work with people where they're at as far as just kind of building things out for them. Anything from what we're offering now called accelerators, which are more short-term, quick burst things that we can spin up for people that might be sitting on Salesforce licenses for quite a while and are looking to find a way to use those to bigger scale projects for people, and just really building out the tools that individuals and companies need to kind of work well within Salesforce. So one of those tools that we actually recently built out was working with Formstack to kind of build out a tool for sending out patient screeners to people that are going to go to their appointment to see whether it's a physician or whether it's to see someone with their mental health. In this case, like I'll kind of bounce around. I'll zoom in because I know my screen's a little larger so people can see better. But I'm just going to go ahead and demo it. I'll try to pause for any questions. But essentially what we've done here is this is kind of a recreation of what we did for a client. And you kind of see like, here's my information here. You've got the person account with any patient information here. In this use case, what we created is a way to kind of send a screener. There's a couple different screeners that go out for you to kind of assess your mental health before going into like a psychiatry appointment. And you would create the screener and you create the appointment in advance. Obviously, most of your appointments aren't going to be created 3 days in advance. That said, just to demo it here, what we've built in the back end is we built a way to kind of automatically send out the Formstack screener, which is unique to this patient. It ties back in based in this case on their email, and it will kind of trigger an email to kind of send out to the person, which I'll receive in just a second here. So I've created this appointment. Kind of the scenario would be, hey, I scheduled an appointment for a few weeks from now, a month from now. And then all of a sudden I get an email sent to me with the forms needed prior to my appointment. In this case, we've set it up where 3 days before it sends out. And then if I don't fill it in, it's going to do another email nudge to me 1 day beforehand, passing over that link. At that point, if I do send it out, if I do fill out the screener, the Formstack screener, then it will not actually re-trigger that 1 day one. And you could see this play out for any sort of form that you have to send out, whether it's you've got your yearly physical and you want to schedule those forms to send out. Or additionally, if you want to send them out manually, we've also built that out as well. And is just as easy. So we've got, you see send screener button up here. I'll go ahead and just kind of click that just to ensure that the screener gets triggered out. It was sent to me, and I'll just kind of pull my screen over quick to show. Here's the email we threw together. Nothing crazy. You can obviously customize the body, and you can put in there anything that you want. From there, just clicking on this will take us to the screener that's been built out in Formstack. One kind of cool thing to point out is that Zach had mentioned is just the pre-fill here. So we're pulling in data from the account. Obviously, if you want to pull in more to the form to show the people how much you know about them, you could pull in more as well. That said, I've pulled in these key pieces of information where if I wanted to edit this and fix my name and switch it to Matt, I could do that. In this case, I've left this email is uneditable, using that as my my field that's going to link back to that account. So I'll just kind of quickly fill this in. I don't really need to fill in the whole thing. This is just kind of a survey to see like, how have you been feeling recently? These numbers will kind of come back to Salesforce and kind of calculate a score for the patient. But again, you can see this being used in any number of ways, whether this is automated sends of screeners or forms to people, or whether it's manually sending someone a bunch of forms for any number of needs. Whether it's you've got a new client and they've got to sign off some stuff, and you've got some forms built out that need to be filled in. So I'll just kind of type that in and hit send. And from here, we've decided to reroute it to our website. You could obviously point that back to just any number of websites, or a pop-up that just says, thanks for filling in the screener. From here, I'm just going to go ahead and hit refresh because this is getting pushed back in. And what you likely didn't notice, but I'll point out here, is this used to say 4, and now it says 5. Obviously, I've been doing some tests earlier to ensure everything is working well. Hovering over here, you'll be able to click into the patient screener that just got filled in, and taking a look, like this is how we've thrown it together with these fields, being more generic here, but any number of things that was filled out in the Formstack form get passed back in here. And from there, you can do any number of things like you would normally in Salesforce, such as calculate scores, or pre-fill any of the other pieces of data that someone has passed over. Going to the related tab, we've been able to actually build out an additional offering that Formstack has using Formstack documents, where you take all the different data within here, and you can, and anything else you have available as well, and pass those into more curated forms that you've maybe set up for someone like a physician that might need to have a PDF version of this printed and handed to them. So if they have a patient coming in, they can review these forms. You'll see all of the different pieces of data that were referenced on the details there pulled in here. And because Formstack is built in a way where you can use all that data within Formstack documents, you can also have it all come in one form, funnel it through Formstack documents, and then split it out to additional, like two different forms as you see here. So it's really a powerful tool, and we actually had the client that we built a very similar thing for is kind of been.
So what was the thing that you wanted?
That's great though. I'm going to do that. Mine was actually just.
Sorry, the client that we built this out for has actually been overwhelmed with how much easier it is to get all these forms in there, and how much traction they've had with it, that they're kind of waiting to roll out some of the additional forms because it's just worked too well. In their case, they're taking these PDFs then and integrating with another system to pass them out. That way, when a physician logs in, they can have access to both key details filled into the Formstack information, as well as the PDF forms as you've seen here. So last thing I'll point out really quickly, and obviously this is just another customization that we've kind of built on our end, but one of the requests was making sure that, like, if someone was over or if someone was under 13, they were not allowed to get these forms. So in this case, the scheduled automation, there's something in there that would stop it from sending. When it comes to the send screener, though, we've also built it in a way where if I were to switch my date of birth here to be older, and here I'm thinking time is a little bit different than what it is. So let's see, what year is it? I click hit a save, and you'll see the send screener disappears. Oh, my apologies. Again, quick math is not my forte here. All right, you'll see that now the person has fallen under 13 years old, and the send screener button drops off. So just another feature that can kind of be used to kind of give that holistic integration within Salesforce and Formstack. I'll stop for any questions or if anyone wants to see anything within here before I pass it off.
Yeah, impressive, Matt. There was a question on HIPAA compliance, which I'll answer. If there's other questions for Matt while I'm answering that, let him know. And then we have more demo coming up with Josh momentarily. Question was on HIPAA compliance. So again, 2 Formstack Forms modules. Many customers use both for kind of the full extent of use cases. Forms for Salesforce Native Cloud. Installed on Health Cloud. Here's a huge benefit of that approach. All data is processed and stored local to Health Cloud, meaning everything that Matt showed you, including the publishing of the form, including the capture of data, that's all running on Health Cloud. Health Cloud's HIPAA compliant, Formstack for Salesforce, HIPAA compliant, running on Health Cloud. That's an approach that many healthcare organizations take. Formstack.com is the external form builder that can also be used to capture data. Many healthcare organizations use that for, let's say you've got non-Salesforce users that you want to support, but then selectively sync data into Health Cloud. That's Formstack.com. That is also HIPAA compliant. It's HIPAA compliant, running with the ability for you to do things like encrypt data when it's stored, and that data will be HIPAA compliant at rest as well as it syncs into Health Cloud. So you've got a lot of flexibility. I'd say most of the focus today is on the native solution, Formstack for Salesforce, but Formstack.com also loved by healthcare organizations. We recently published a customer story, in fact, about the Formstack.com for Will's Knighton Health System. Just happen to have that up here on my screen, so I'm going to post that link in the chat for folks to take a look at. Kevin just posted a question for you, Matt. I can read it off for you. Can you talk about how you use Flow as part of the build? And Kevin points out that, Flow and Formstack are really nicely paired together.
Yeah, no, for sure. So we used it really in automating I should say both the 3-day send. So if you have your appointment set up, it'll kind of pass out that email 3 days beforehand, as well as the 1-day portion of that. If someone doesn't fill in the screener, it kind of checks there before it sends and says like, hey, is there a screener existing that's been created in the last couple of days? If so, don't resend this. And then additionally, we built a flow just kind of for that one-click send that screener to a person as well. And just, as it integrates well with Formstack, they give us, within building that, a dynamic link that kind of gets matched up with the data within, the account, where all we need to do is grab that individual field, pop that in the email and send it off. So if you didn't, for instance, want to build a flow for that manual one, and you just kind of had a bunch of different links there, you could copy and paste those or have email templates that kind of pull from that individual field in there, easily sending it out to giving the person the right forms they're looking for.
I'll also add that Flow works just as well with Formstack documents. I love the document automation solutions. Let's say based on a patient stage or status, being able to trigger the generation of a document that could be emailed to that patient, could be routed to another system. Heck, we still have people using things like our fax or mail integrations to support even those kind of processes as well.
Yeah, I had those forms built in a way where it's like, as long as they answer one of the first two questions, it's going to generate that. But to Zach's point, it's like, if you have a very specific use case where it's like, we're looking to only generate these out if someone meets a certain criteria, you can kind of select multiple criteria to make sure it's very, uniquely triggering that and generating those PDFs. And yeah.
Yeah, Tina's example of a pre-filled form sent to your mobile phone is way more modern than my fax example. So thank you, Tina. All right. Well, Matt's going to still be here. So if there's questions, Matt will still be on, but probably a good moment to introduce Josh. For those SIs on the phone, as Josh is getting prepared, I'll just kind of explain. Formstack's partner engagement approach is very collaborative, and everyone on the Formstack partner team, again, you've got others on here, including Dylan and Jimmy. We all know Formstack, we know Salesforce, so there's a lot of day-to-day collaboration. Josh gets involved both quote unquote pre-sale and post-sale, working with partners as you're designing solutions around Salesforce and Formstack. So no one better than Josh to share today. Josh, I'll hand it off to you.
Thanks, Zach. I'll go ahead and share my screen here. Sharing my screen, I'm going to jump right into, get the Zoom out of the way here, jump right into our children's health system, just website here, just to show you another use case where Formstack forms being used for an unauthenticated user in a non-pre-fill capacity. So Formstack forms can be hosted on websites. They can be embedded in an existing website as well. They don't have to be sent out there via email to like a hosted link. So in this case, like looking at a patient registration form, we have a form embedded on the website. This is completely synced into Salesforce. I'm just going to go ahead and fill it out because in this particular use case, this form will actually trigger a document to be generated and then sent back for signature. So in this case, we have the different fields, pick lists, and I'll show kind of behind the scenes how this is, but pick lists being built, read right out of Salesforce. So you're not having to set those up when you're building your forms. Conditional logic can be built right into the form to capture conditional fields. You can, upload documents right in. Those documents can go right into Salesforce as well. And then in this case, like we can add additional members, which adds a page, and we can add related information. So here we can, continue adding as many as the form allows us. But if I create, a record, this will create that related record. In this case, this should generate a document, send it out for signature, in addition to sending the information back to Salesforce. So again, touching on that Formstack documents and then going into our digital signature product, Formstack Sign, the documents generated and then sent out for signature. So if I hop over here, I have the document here ready to review and sign. So here we can see that it generated a document based on the information I put in, and then it's authorizing this for signature. So any forms could be pre-registration for a patient, getting some forms signed before they even come in, based on them filling out an initial inquiry on the website. Or you could also do this off of a pre-filled form that then sends them the correct forms to sign. And upon signing that document could be delivered back into Salesforce and associated with that record that was created.
Zach, are you seeing the questions in the chat? I know that you have some authentication things to prevent spam, and then there's also a little bit of, I think we already covered the workflow with the flows, but.
Yes, yeah, I'll tee up Murali's question. So Murali is asking, how can we prevent spam form submissions? So I think Marala, yeah, you're asking about how to kind of ensure that you're not getting unwanted form submissions from bots or other techniques. Josh, do you want to speak to that one?
Yeah, so you can use there is integration with Google CAPTCHA that you can add to your form. So if you want to use CAPTCHA to try to prevent spam, that is a common thing that's added to the forms there when you configure. And I can kind of point that out here. The honeypot, yeah, the honeypot. So depending on how you want to implement honeypot completely, I've seen it done. You can have hidden fields on the form. Obviously, that would be those honeypot fields. And then you could use, you know, in some instances, you could use rules or JavaScript on the form to prevent that form from being submitted if that hidden field was filled out. Or you could even handle it on the Salesforce side if you wanted to do away with that record if that honeypot field was completed. So 2 different options there with the honeypot fields.
Yeah, I shared a link out describing the CAPTCHA approach on our help site.
Perfect. So here I flipped over to what the actual Forms for Salesforce looks like within the Salesforce org. It is a native tool, so you're logged into your Salesforce org, and that is where you're building your forms. So from a licensing perspective, only the users that need to build the forms are the ones that actually need Formstack licenses. So you don't have to license anyone that's going to be filling out that form. You do have the option to create, you know, a form that's hosted, you know, outside of a community as well as community forms. So I showed the hosted form, Matt showed the form delivered via email, both of those being that non-community form. You also have the ability to build forms that are hosted within Experience Cloud that can grab that logged in user context and have information pre-filled based on who is authenticated into Experience Cloud. In this instance, I'll just show you kind of how the builder works, and it's how it's native to Salesforce and built off of the Salesforce data model. So we'll try to create as close to possible, as quickly as possible, to show you how quickly a form can be spun up, a form that is mirroring somewhat of what I had filled out previously. So here I'm just creating a regular form, and I'll select a primary object. So essentially, you pick the form that you want, the object you want that to interact with. Could be a standard object, could be a custom object. It is built using Salesforce API version 54. So Health Cloud objects are supported. You're familiar with or had used the tool previously. That is a recent update in the past couple of months, which Justin could allude to, but we do now support the Health Cloud objects being on API version 54 in the app. So here we'll just build a form that is built off of contact. And then from the contact, we can begin going out to related objects. You can go 1 object down, 2 objects down, child, grandchild objects is, if you're familiar, that native cloud high compliance. It is a feature that is right around the corner. So will soon be supported on native cloud. So essentially 1 level up, 2 levels down on the objects that can be supported on a form. So here we could throw on the account of the contact. And then for that repeated child, let's say we have a custom object called relationship in this instance, in this environment I have, that we could make repeating or non-repeating. So say I have an application object as well, and I want this form to create 1 application as a child object. I can make it non-repeating and make that other object repeating. When we hit create form, this is where the form's doing some of the magic. It's reading that data architecture behind the scenes, and it's going to pull any of those fields that are required at the system level onto the form. So if you're building a form and you have a user that's not, have a full grasp of everything on that data architecture side, they can still build a form. The required fields are going to be brought on, and they don't have to worry about having those fields on the form and for the form to successfully submit. So in this case, it brought over that last name from the contact and then account name from that related account. When you're building a form, on the right, you see the objects that were added, and then you can gain access to any of those fields on the object. So this case, you can also search. So let's say we want to add last name. Did I miss? Not sure why. Oh, it's because it's already on there. I'm like, what? We want to get first name. So we'll grab the first name of the contact. You can double click and add, or in the case of like email, you can drag that on the form as well. So double click, drag and drop builder. There's no coding involved. There's also no mapping involved. So as you're adding these fields to the form, it is knowing exactly where that data needs to land in Salesforce. If you add, for instance, let's come in here and add lead source as a pick list. If I add lead source to the form, it recognizes that's a pick list in Salesforce. If I expand those options here, I can see that it's automatically brought in those pick list values onto the form. So no need, as I'm building the form, to add all those individual options to later map into the appropriate option set in Salesforce. The same is true for those date fields, for long text fields, for number fields. It's reading the context of the field to know what type of field to put on the form. You can add sections, pages to the form to break it up in the instance of those repeating. So that relationship, if I try to add those fields, it's going to automatically create that repeating section for me to remove or add another. In this case, we can add, an application. So if we want to create a blank application record, we could, throw the status field on here, and let's make it hidden and set a default value of in progress. That will now create that application record when the form's submitted with the status of in progress, and it's hidden. The user doesn't know it's happening. In the field settings, you can change the labels. So if the Salesforce label is one thing, you want it to be different on the form, you can change that. Here you can notice that the mapping is taking place as you're building. You will also have the ability to mark fields for upsert. So if we wanted to, on email, say we found a matching email, we want to update an existing record rather than create a new, we can set fields for upsert. Any questions on building based on Salesforce architecture here? Okay.
Josh,
General field.
Actually, Josh, Tina asked just to describe how we work with person accounts.
Yep. So person accounts are supported in our native Forms for Salesforce tool. So some of the gotchas, that off-platform core product, that product doesn't support person accounts currently, but on our Forms for Salesforce, person accounts are supported. Bring that account on, and then you're going to have those name fields that are associated more with those person accounts. General fields are fields that are not mapped to Salesforce. So if you need to add conditional logic to the form to show or hide sections, pages, common use case for a general, radio button to just put that yes, no toggle on the page, not map it to Salesforce. This is also where file uploads take place. So if we add a file upload here to the form, we then have the ability to pick any of the objects that are on the form to actually upload that file to, if we want. Signature field also, which you saw in Matt's demo, that's where that signature field lies as well.
Josh, do you have any limits on the uploads? Is there a number of documents or size of documents or?
Yeah, so in assuming use case is probably going to be native cloud and those, health cloud instances, there is a 2.5 megabyte limit to that file upload field when you add it to the form. Any questions about the form builder? Or I jump over here to the conditional logic. So in this case, just so I can show conditional logic, I'm going to add a radio button here, make it you can come in and edit the options. So let's just make a yes, no, if I could type. Long day. And let's just say, do you want to upload a file? And we'll make this hidden. You can control that again. So here's, let's say we want to only show that if they want to upload a file. Our rules, pretty powerful engine. It's not just show hide what I'm going to show you, but you can also populate other fields. So you can do calculations using populate. You can populate default values based on other actions on the form. You can make fields required, not required conditionally. But in this case, let's grab that radio button of do you want to upload a file? That's equal to yes. Again, show hide is what we'll use, but you can populate, make required, not required, read only, display an error message. So if you want to do some custom validation on the form and display an error message, you can handle that with rules. Set pick list values. If you want to create dependent pick lists on the form, you can do that using set pick list values, but dependent pick lists are now supported. So if you have dependent pick lists built in Salesforce, if you bring that controlling independent field on the form, it will inherit that dependency from Salesforce. You don't have to rebuild it. So in this case, let's go ahead and show that file upload field based on that rule. And you can, add as many rules as you need here. Keep clicking too hard. Style, you can custom style. So in both the instances, you saw some of that styling. This is out of the box. You have a UI here that you can make changes to. If you need to take complete control, you can edit the CSS directly. Once you've created a style or a template, either here using the AI or with CSS, you can save that as a custom template. And then in this instance here, you can select that custom template and it will apply that to your form. So you don't have to do that with each and every form. Alerts, just touch on it quickly. The alerts is where you can go in, adjust, emails that are going out, whether they be error emails if you're using save for later, or in the instance, if you want to send a notification to the person that completed the form, you can set that up in custom alerts. In form settings, this is where you can control that, displaying the confirmation pop-up or redirecting to a new page, as Matt alluded to. This is where that reCAPTCHA is for your forms, if you want to set that up. And here you can add navigation bar, control form validation, whether it's one page at a time on submission, toggle save for later, and in instances where you want to take complete control over your form, you do have the ability to add any JavaScript to it. So here we'll close the form settings, and just to show you kind of how quickly we can create this form, set it up for pre-fill. I'm going to go ahead and publish this. Publishing this form will create the form for us. Let's go to publish options. So here in publish options, we can see now if we want to embed the code that we can copy and paste onto the website to embed that, or we have that hosted form. So here I can click this link and you'll see that the form is here already built with the fields that we selected. I must have done something to my template earlier because it's messed up from what it usually is, but I did apply the styling there. If I hop back, sorry, it is in another tab. If we want to look at pre-fill, I'll toggle dynamic pre-fill here. So for the pre-fill of the forms, there's no mapping involved either. Again, it's native, so it's going to take care of all that for you. So by toggling dynamic pre-fill, I've now turned this form on to pre-fill all objects. I can control that at the object level. So say I always want to create a new application with the form, I can deselect that for pre-fill. Those repeated child objects, I could say, hey, I only want to pre-fill relationships that are parents, and it will pre-fill only those parent objects if I wanted to. Once I have saved those pre-fill settings, now I have the option to generate those pre-fill links. So in the instance of Matt's example, there's that pre-fill link that is sent out via email. I could auto-generate those using by selecting a URL on the record. So select a URL on that primary record. Apply for new records would automatically create a trigger in the environment to create that URL every time the record's created. In this instance, I have a couple records already created. So I want to select an existing list view, and I'm going to click updating existing records. And now that one record has been queued. So now if I go to Jim's record on that secondary URL, I now see it's populated. I click, and within a matter of seconds, we have set up a form for pre-fill for Jim. So that URL could be used in email, if you have text messaging and a text message, whatever, to send Jim to that form. So here within 10, 15 minutes, walk through building a pretty simple form with multiple objects on it that is set up for pre-fill. And again, if I, adjust that last name, send, thank you for submission. If I go back to Jim's record and refresh, his name is now Jim Hopper Jr. It updated his record. Any questions about pre-fill? Setting that up. Okay, I will pop it back over to you, Zach.
All right, thanks, Josh. So we've seen Matt's use case. We've seen Josh's demo. Any questions for any of us here? We're all ears if there's anything anyone else wants to ask about or hear us on anything you've seen or haven't seen today.
If I could, I'm going to come off mute real quick. So I will tell everyone how much I love Formstack, and I do, but everyone who listens to anything I say knows I'm also pretty candid of what I don't like. So one of the things I do want to call out is the Formstack form. At least a year or two ago when I used it, it's been a while, but for branding, for making it look pretty, things like that, dropping a Formstack form on a Sitecore page, things like that, you can, I just find it's still, you may need someone who has some really serious web skills for CSS, HTML markup to really take a Formstack form. So I think that's something to keep in mind. I really like it for the fact that you can use the form for patients to pre-fill out or things like that, that it is secure in HIPAA with the Formstack version for Salesforce. But I do want to call out when people are looking at this as a web form, you do have to be aware that unless you guys have done changes, that this, that was something I struggled with your form, right? Getting it forward facing on websites. So I want to call that out. And then have you guys, when you're doing your document generation, you had your signature too. Have you done more investment on that where you have your document generation and signature on mobile? Because during COVID days, I had worked with you guys to try to spec something out, but we never actually came to fruition with that person. But how are you doing with that? Your document generation, someone's got a mobile device and they can sign on that, which also would tie in what Salesforce is trying to do with their assessments.
I see, yep.
And that's really, I think Salesforce just deployed that and ignored it. So that ability in healthcare, when you're looking at forms like behavioral health, going on site and traveling, having those forms and having that signature in a mobile environment. Have you guys spent more time in developing that?
Yes, is the quick answer. I can kind of walk through all the different ways Formstack does signatures. Backing up to Tina's previous constructive criticism, I definitely, we characterize Formstack as a, no code, low code solution. There's a lot you can do without code, literally deploying a form and customizing it, in minutes or longer, depending on what you're doing. Where the low code is going to come in is styling. So it's, we're CSS compatible, we're JavaScript compatible. So those kind of front end skills will often be used for a full scale implementation, especially if you're deploying Formstack across websites and other web properties. On the signature side, there's actually 3 ways we can do signatures. You can have a signature on a web form. So what Josh showed you, you can drag and drop a signature component on there. I like to describe that as e-signature. You know, I wouldn't use that necessarily for like a binding customer contract, but I would use it for, you know, recording that there's been an authorization recorded, an acknowledgement's been recorded, because you can save that, you know, straight to a Salesforce record as well, you know, as consent. We also have a full digital signature product that will log, you know, every interaction with a document. It'll stamp that document with a court binding signature. That is typically used once in conjunction with Formstack documents, generate a document, route it for signature to an individual's email or even mobile message, you know, text message. So Tina, you could accomplish what you described on mobile. And I'm going to get to our third scenario, but by, you know, generating a document, routing it for signatures to someone's mobile device, to someone's email, that could be a multi-step process. Formstack Sign has its own standalone interface. I will say this, you know, we're getting a lot of DocuSign business these days, especially, you know, as budgets crunch. Formstack Sign is a great solution, you know, to basically probably save a lot of money on DocuSign licenses for digital signature use cases. Tina, what I think you were wanting is scenario 3, which is, we would call that embedded digital signature, meaning going directly from a form to something that is user identified and binding as a web experience. That is part of something that you're going to be hearing more about from us in the early next year timeframe. So stay tuned for embedded signature experiences.
Okay, and then they can
Yep.
actually open it and see the signature and the whole 9 yards, and it would be binding as well.
Yes, so kind of combining those two concepts. And again, we can
I
do
don't know
some
if people-
breakout discussion on that topic, but that's a quick rundown of what we support today and what's coming in the future.
No, that's awesome, because I don't know if a lot of people realize Salesforce signature functionality, where they talk about the assessments and the patient can sign for that, and they pitched that as part of that. I don't know if a lot of people realize it doesn't store the signature. It stores a code. It doesn't store an actual visual representation of the signature.
Yeah.
At least a year ago when I looked at it. So
yeah.
No, that's good to know from that. I think you have some other questions.
Yeah. Josh, I'll read Priscilla's and your answer, and then if you want to take a look at what Morali asked next to talk through. Priscilla asked, are there data validation options? Answer there, standard validation based on field types. And you can do custom validation using rules. So Formstack has a whole rules engine where you can do conditional rules, and validation is often covered there. Depending on how complex, that also could be a case where you may supplement that with JavaScript as well. Morali's asking about, quote unquote, the safety of our prefill, security risks that may be involved in prefill, and how we think about that and approach that. Josh, do you have any comments on that? I could also weigh in, but any comments on that question?
Yeah, I mean, I guess generally speaking, the way that dynamic prefill works is it's essentially taking different elements like org ID, form ID, record ID, and encrypting them. Essentially encrypting them using key that only the Formstack, managed package knows how to decrypt. And then if any of that key gets that string gets changed, it just will pull up a blank form versus a form that is pre-filled. So definitely much more secure than just passing query parameters or passing a record ID that could be more easily tried and figured out to pull in information, because you need a combination of things that all work in order to get information back out, and then not only get the right combination, but also have it encrypted correctly. So
yeah, the key point there is that's an encrypted link. So there's much more basic prefill you might see from other approaches like query strings. Formstack for Salesforce way more secure. It's encrypted and it's tied to your Salesforce org, as Josh said. Tina asked about Salesforce Shield, the native cloud product. Again, that's the version that any healthcare customer is going to be using typically, because that's where everything is processed and stored in Health Cloud or whatever Salesforce CRM you're using. Native cloud is compatible with Salesforce Shield, meaning you could have an encrypted field that you expose on a form to capture that data, and that'll all work really nicely together. A few moments ago, I think I'll repost it because we've had some good conversation, but I always bring my Formstack form with me to any meeting or session like this. So I've just posted a simple use case, but if you guys want to give us feedback on today, let us know how we did. Also, if there's anything we can help with, let us know. All of this is on the AppExchange. I probably should have mentioned that, but I'll also try to grab our AppExchange links here. But if you're the try it kind of person, you can install Formstack in an org. There's I think it's maybe a 14 or 15-day trial. But if you need that extended, reach out, send us your org ID. I'll post the link to Formstack on the AppExchange. Formstack Documents has a separate listing for the DocGen product as well.
Thank you, Zach, so much.
Yeah, any final question? We probably have time for one more before the top of the hour, if anyone didn't get to anything that was on their mind.
Is that 15 days in a sandbox too, Zach?
Yes, it's going to be the same in the sandbox, but again, if you're a customer, you can connect your production org to as many sandboxes as you want. We have form migration tools that allow you to push forms from sandbox to production. So if you're a licensed customer, you're going to be able to get all your sandboxes connected and licensed, no problem. If you're on a trial, then yeah, it's going to be typically a time frame. Our partners can get complimentary partner licenses for any demos like you saw from Penrod today.
I just want to give you a 2-minute warning too. We're at 2 minutes.
Well, I want to use the time to thank Kathy and Tina for being our great hosts, and Matt and the Penrod team for an awesome demo. Kevin from Penrod is on as well, as is Katie, I believe. Yep. Or she may have hopped off.
Yeah, thank you guys. We appreciate the opportunity to join.
We're glad you were here. Next time we'll see
I
a
know.
camera, right? I'm just joking.
He had his camera off for a while, so he had. But thank you, Zach and team and Matt and everyone else for doing the presentation and answering those questions. Again, I will say time and time again, Formstack is a great partner. And thank you for all that you guys do. We will be posting this on YouTube. Zach, any links that you want me to include on the YouTube video in the comment section, just so it sends me an email, please. And then any follow-up questions, y'all can reach out to us in the community, the Trailblazer community. You guys know how to find us. And with that, I will wish you all a great evening.
Thank you.
Yes. Thanks everyone. Have a great night. Bye.
Thank you.
Bye.